and welcome to all of our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And here at Gold, we are getting ready to prepare for our Gold Neonatal online conference. And I have a special guest with me who is the speaker in one of the add-on packages, Dr. Gayatri Jape. Welcome back, Gayatri. It's so nice to have you here today.
Thank you, Christine, and thank you to Gold again for this amazing opportunity.
Yes, you've been with us before here at Gold, and we have invited you back because we love the material so much that you've presented here. You have such solid research you're always providing to us. So we love having you back here at our conferences.
Thank you.
So for any of our viewers who are not yet familiar with you, where in the world, let's start out with that. Where in the world are you located? Where in the world are you?
So I'm located down under, so which is in Australia and specifically Western Australia, which is quite a big and very geographically diverse state. Yep. So yes, so I'm located in Perth, which is the capital city of Western Australia along the west coast of Australia.
Beautiful. Well, thank you for sharing that. Yeah, and I always find it fascinating. And for me, it never gets old to know, to find out where our speakers are coming from, where our viewers are located to, because I feel like it's a field, especially the field of also neonatology. Everybody is so passionate about their work and new research and what's coming out and what's new and where we're going from here. And I just find it so wonderful that we can learn together from all around the world, you know, and you know, be part of this amazing educational community here. So I always love knowing where our speakers are from.
So that's amazing because you guys are bringing the community, like the world, closer together
Oh, that's
through the use
great.
of technology.
For the use of
Perfect.
technology. That's right. Yes. So let's talk about also your background. Tell us a little bit about your background in the field.
Yes, so I have been a pediatrician and neonatologist for the past nearly 19 years now. So it's been a very exciting journey, which started off, like after my undergraduation was complete, or what should I do? And this was something which I was always interested in, and it has thankfully like evolved and made me, I'm quite in a privileged position, I would rather say right now, to be able to make these impacts on small babies and their longer term outcomes as well as their families, of course, because we want to provide holistic neonatal care and with the best possible evidence which is available.
Holistic care. I absolutely love that, with the best evidence that is available, and integrating and kind of making sure that the families are part of this care too, right?
Absolutely.
This family-centered care, that's something I feel like we're getting better and better at in the field of neonatology. You know, before it's kind of, we're doing all these rapid developments in the field, like technology, and there's so many changes also in pharmacology that we've seen over the years, but also now adopting a holistic approach and integrating the family. I just find that absolutely fascinating and wonderful at the same time.
Thanks, Kristen. Yes.
Now let's talk about your presentation about advances in the enteral nutrition high-risk neonates. So tell us a little bit, first of all, how did this particular area become an area of interest and expertise for you?
So, this was actually a very important, it is an interesting and very important area because we know that nutrition in the first 1,000 days of life plays a very important role. It's actually setting the stage for the baby's overall and most important brain development in the first 1,000 days of life, whatever you do. So any strategies to improve enteral nutrition, like for example, looking at feed volumes, how fast you increase their feeds, what can you do to try and improve their feed tolerance, simple interventions such as providing mother's own milk or, mother's milk alternatives like donor human milk, which is now available in many neonatal units across the world, or other additional interventions such as probiotics and other elements which are added to milk, whether fortifying milk early, late, how much to fortify, what duration to fortify, are these making a very important impact on the baby's enteral nutrition. So, the way I got interested in nutrition was because there were simple debates every day during even the ward rounds, like clinical rounds with the nurses. Do you think you're increasing the feeds too fast? Do you think you're
Mhm.
increasing too slow? So starting with those simple debates, actually, it got me really interested in the field of nutrition. And then as more and more literature actually came out on the importance of enteral nutrition in particularly in the first 1,000 days of life, I think it's very, very crucial that we focus on this important area. And as I have actually talked about in my presentation, that enteral nutrition obviously is a better way to provide nutrients compared to parental nutrition, although that definitely needs more evidence across certain domains. I still think that's feeding the baby and making sure that we are optimizing enteral nutrition is always a priority for all neonatologists and
Mhm.
everyone who takes care of babies all across the globe.
Yes, yeah, absolutely. It's fascinating what you described there about this question also, when you were doing the rounds and everybody asking, are we doing it too fast? Are we increasing the feedings or not fast enough? Or it's fascinating because you feel like, isn't that something, because it's so it's something so profound in the care of this neonate, that you think like, oh, there's still all these debates about it, right? Don't we have like a formula? I'm talking about a formula for like how much to feed, not formula feeding. That's but
Yeah,
don't we have that down yet? So it's
yeah, yeah.
really, really fascinating what you're describing there, and absolutely love that you are looking at the holistic background. The human milk, if it's donor milk or the milk from the parent. Yeah, absolutely wonderful that and the research shows that it works. It's the right stuff for the baby, right?
Yes, absolutely. Nature has already taken care of it.
Nature has already taken care of it. Well,
Yes.
Gayatri, it's been wonderful chatting with you here. It's been absolutely fascinating. I love looking forward to listening to your presentation, and that will be available May 30th as a recording here. And thank you so much for coming here and spending some time here with us at Gold.
Thank you, Christine, and thank you, Gold, again for the excellent opportunity.
And for our viewers now, this is some information for them now. If you would like to find out more about this presentation and all the other presentations in the lecture pack and the Neonatal Online Conference, please visit goldneonatal.com. On May 30th, we get started with our open access keynote presentation. That's open access to anyone who is interested. You'll find that all the registration links for that there as well. So thank you everyone for watching today, and I hope to see you at the conference. Bye-bye, everyone.